Hello everyone, this is your student nurse again, Ashley C. Rumbaoa, studying Bachelor of Science in Nursing at Northern Christian College. And for today's video, I am going to demonstrate on how to take blood pressure manually. So why getting blood pressure manually is important? Blood pressure measurement is a commonly performed procedure in most healthcare settings and provide essential information to aid diagnosis and monitoring. It is vital that measurement gives accurate results to ensure patients receive the correct treatment and care in a timely manner. So without further ado, let's start! Steps on how to take blood pressure manually. First, perform hand hygiene and gather supplies. Supplies needed: stethoscope and blood pressure cuff with its 5 ml manometer. Tip: always use the right size cuff. Second, have the patient sitting or lying down with the arm at heart level. Turn the arm outward with the palm up. Be sure the legs are uncrossed. Find the bronchial artery. This is the most common site for checking the blood pressure and is a major artery in the upper arm that divides into the radial and ulnar artery. To find this artery, extend the arm and have the palm facing upward. The pulse points is found near the top of the cubital fossa, which is a triangular area that is in front of the elbow. Third, place and secure the blood pressure cuff on the patient's upper arm. Place it about 2 inches above the elbow. In addition, make sure the arrow on the blood pressure cuff is lined up with the bronchial artery. Don't place the blood pressure cuff over clothes or the gown. So now, we will estimate the systolic pressure by palpating the bronchial artery and inflating the cuff to the point where the pulse disappears. Note that number on the gauge when you no longer feel the bronchial artery. Then deflate the cuff and wait 30 to 60 seconds.
Don't forget to sanitize your hand before proceeding. And don't forget also to get the patient's information.
Hello ma'am, I am Ashley C. Rumbaoa, first year nursing student at Northern Christian College. Can I just check your name and age, please?
Yes, of course. My name is Cheryl and I'm 22.
Nice to meet you, ma'am. Today, I'd like to take your blood pressure, so that will entail me taking this cuff, deflating it around your arm, feeling and listening to your pulse. Does that sound okay, ma'am?
Yeah, that's fine.
It might be a little bit uncomfortable, but it wouldn't hurt you. You okay for me to go ahead, ma'am?
Yeah, sure, please.
Okay, ma'am. So now I will start to take your blood pressure, ma'am. Can I take your left hand, please?
We will estimate the systolic pressure by palpating the brachial artery and inflating the cuff to the point where the pulse disappears. Note that number on the gauge when you no longer feel the brachial artery. Then deflate the cuff and wait 30 to 60 seconds. Place your stethoscope in your ears. Palpate the brachial artery again and place the bell of the stethoscope lightly on the brachial pulse site. You can use the diaphragm rather than the bell if you want, but the bell is the best for hearing low-pitch sounds. Inflate the cuff 30 mmHg above the number you felt the brachial artery disappear when estimating the systolic pressure. For example, if the brachial artery disappeared at 100 mmHg, inflate the cuff to 130 mmHg. Deflate the cuff slowly with the valve about 2 mmHg per second. Listen for the very first sound and note the point on the gauge when you heard it. That is the systolic number. Continue to allow the air to leave the cuff and note the point on the gauge when the sound stops completely. That is the diastolic pressure number reading. And then open the valve completely and let the air leave. And then remove the cuff. Remember to clean the cuff and device if multi-use device and perform hand hygiene. Document the reading and which arm you measure the blood pressure in. Her blood pressure was 100/80.
So that is how to get or measure blood pressure manually. Again, this is Ashley C. Rumbaoa, your student nurse for today. I hope you learned something from this video. Until next time!